Can weight loss and calorie restriction really reverse type 2 diabetes? So I'm bringing the subject up because there's an article on Medscape that was the title of the article. I'll read it to you. Can weight loss lead to real remission for type 2 diabetes? In the article, basically it says, look, by the time somebody's diagnosed with type 2 diabetes, they've already damaged 50% or more of certain cells in their pancreas. And in the article, it says the damage to those cells cannot be reversed. Here's the problem that I have with this article is it doesn't say that the body's able to heal and repair itself. Those cells can be healed. They can be repaired, and it can be reversed. Your body's meant to heal and repair. Calorie restriction, decreasing your sugar, obviously, the fundamental way you're treating your body can reverse diabetes. It's going to be a long process. Pancreas cells do heal and repair. You do grow new pancreas cells. You get new ones. Your heart cells repair. You get a new heart essentially every 7 years. I have so many people that have come to us over the years with neuropathy, and they said, my doctor told me the nerves are dead, nothing can be done about them. And in the vast majority of cases, we're able to prove that wrong, and we're actually able to reverse their symptoms and get them healing and feeling normal again in most cases, not all cases. So the nerve cells are the cells that people agree the most can't be healed and repaired, and yet that's occurring. Your body heals nerves. So I think it's incorrect to say that the pancreas cells can't heal and repair, and you can't get new ones. There's actually been studies where they've taken type 1 diabetics, now different type of cell, different situation, where they've injected the pancreas with stem cells and taking juveniles with type 1 diabetes and actually getting them to reverse that autoimmune disease, which means they actually get the pancreas through stem cell therapy, injecting stem cells into the pancreas to get the pancreas to start producing insulin again. So to say that it's impossible to reverse, like really reverse type 2 diabetes, I don't agree with this article. I don't agree with this article at all. Can it take a lot of work? Yes, it can take a lot of work. Do you have to do all the right things? Yes. And reversal of type 2 diabetes versus putting type 2 diabetes in remission, according to the article on the semantics, are two different things, which I would agree with are two different things. They are looking in the article saying, yeah, remission is possible if you kept up your good habits, but reversal isn't. I disagree. I think it's possible to reverse type 2 diabetes. If you have family members that have type 2 diabetes, I want you to know the research says that 95% of all cases of type 2 diabetes can be reversed with diet alone. That's what large-scale research shows. So it's possible to do that. Does it take work? Absolutely. I'm Dr. Dave Morris at Magnolia Medical Center, Murfreesboro, Tennessee. We're a root cause functional medicine clinic. We help people get out of pain without drugs and surgery, help people reverse their neuropathy without drugs and surgery. We help people with complex metabolic issues like diabetes, like thyroid issues, like autoimmune issues, again, without the use of drugs and surgery. I also help people understand and really kind of understand what's happening with their lab work by giving them appropriate reports based on their labs. That's functionallabhackers.com. Anyway, let me know what you think about this subject in diabetes. Let me know if you've had a loved one that's had diabetes and they've been able to reverse that situation or that condition without the use of medications through the changing diet and lifestyle. Let me know in the comments below. Also, hit the follow button. Take care.